How is pancreatic cancer staging workup done? Imagine trying to solve a complex puzzle about how a cancer has spread in the body. That's what the staging workup for pancreatic cancer aims to do. It's a detailed process that helps doctors understand the size of the tumor, whether it has invaded nearby tissues, and if it has spread to other parts of the body. This information is vital because it guides treatment options and helps predict outcomes. The first step usually involves advanced imaging tests. A pancreatic protocol computed tomography scan, or CORT scan, is the standard initial test. It uses special contrast dyes to produce detailed images of the pancreas, nearby blood vessels, and the liver. This helps determine if the tumor can be surgically removed. The CORT scan is very accurate for assessing whether the cancer is resectable, borderline resectable, or unresectubbed. Endoscopic ultrasound, or EUS, is another key tool. It involves inserting a small probe into the stomach or duodenum to get close to the pancreas. EUS provides detailed images of the tumor and nearby lymph nodes. It can also measure the size of the tumor and see if blood vessels are involved. Plus, EUS allows doctors to perform fine needle aspiration, which means they can take a small tissue sample to confirm the diagnosis. To check for spread to the lungs, a chest CORT scan is often done. Sometimes, magnetic resonance imaging, or MRI, is used to get clearer pictures of the liver if there are uncertain findings on the CORT scan. PET scans and endoscopic retrograde cholangiopancreatography, or ERCP, are additional tests that may be used in specific cases to gather more information. Biopsy is a crucial step. Usually, a tissue sample is obtained during the EUS procedure. This confirms the presence of cancer cells and helps guide treatment decisions. When imaging results are unclear about whether the cancer has spread, doctors may perform minimally invasive surgery called laparoscopy. This involves small incisions and a camera to look inside the abdomen. It can reveal hidden metastases that imaging might miss. If the cancer appears unresectubbed during laparoscopy, further surgery can often be avoided. Assessing the lymph nodes around the pancreas is also part of staging. The involvement of nearby lymph nodes influences whether surgery is possible. If only a few regional lymph nodes are involved, surgery might still be an option. But if cancer has spread to distant lymph nodes, it usually indicates advanced disease that cannot be cured with surgery. All this information is combined using the TNM system. T stands for the size and extent of the primary tumor, N for regional lymph node involvement, and M for distant metastases. Based on these factors, pancreatic cancer is classified from stage 0 to stage 4. The staging helps determine if the tumor is resectable, borderline, or unresectubbed, guiding treatment choices. In summary, the pancreatic cancer staging workup is a thorough process that combines detailed imaging, tissue diagnosis, and sometimes surgical exploration. It involves a team of specialists including radiologists, surgeons, and oncologists working together to get the clearest picture of the disease. This careful evaluation ensures that each patient receives the most appropriate and personalized care possible. Always remember, if you or someone you know is facing this, consulting with healthcare professionals is essential for the best outcomes.